Good afternoon, everyone, and thank you for being here. We don't have Dr. Cantor with us today. He's taken, I think, some well-deserved time off. But we do have Dr. Dawn Marcel, who is with the Department of Health, and she's the Regional Medical Director for Region 2, which is centered here in the capital area around East Baton Rouge Parish. So she will be here in Dr. Cantor's stead, and she'll give you some updates in just a few moments and take your questions. But we are also today joined by a very special guest, Nurse Carla Brown. She has vaccinated 994 individuals throughout the community for COVID-19. She has a very compelling story. Her husband passed away in July from COVID, and she's made it her mission to vaccinate as many people as possible so that others don't have to experience the loss of a loved one the way that she has. And she has a very unique story about how she is engaging the public and administering these vaccines. And so we're going to start with her, and she's going to come up and share a bit of her story with you, and then I will come back on the backside of that, and then Dr. Marcel will come up. So come on up, Carl. Thank you.
Good afternoon. Thank you, Governor, for inviting me, and to everyone that's present. My name is Nurse Carla Brown. My story is what brought me here today. It was the loss of my husband due to COVID. Working as a psych nurse, I brought the COVID home. My husband had survived cancer 2 times, a gunshot wound to the head when he was young, only to succumb to a virus that I brought home. Through my grief and guilt, I was able to reach down deep in my soul of my faith. And I pledged to David that I would do my best not to let his death be in vain. I started a door-to-door campaign, knocking on doors, educating as many people as I can that this was not a hoax. This virus is real, and it crosses all boundaries. Began educating, and then after I looked at some data. Well, let me back up. I was working as a psych nurse, and so now I'm working as a hospice nurse. And some would say, well, that's too far on each continuum, but I celebrate life, but I want to ensure that any person that died working under our care have a dignified, peaceful death with loved ones and people that care for them. I was not able to do that with David. Out of all of the things he went through, because of the COVID restriction, my husband died alone. So now, yes, there is a campaign, and I'm pleading with every American, please get the vaccine. We are there to give you true data. You must understand this vaccine was made to save us. The young, the old. It is important. Through the help of Mayor Sharon Weston Broom, who helped also expedite our legal status of registering to receive the vaccine, I was able to team up with Paul Bartolone Pharmacy. So now we are doing a 2-side campaign. We grassroots, knocking on doors, registering our constituents or our patients to receive the vaccine. Once we register them, we come back and give them that vaccine. And we will come to wherever the call is. We will go to your job, your home, wherever you're at. So there's no more excuse that the vaccine is not available. Through the help of the governor and Mayor Sharon Weston Broom, the doors is open for we the American to receive this vaccine. So now with us having people to come to Paul Bartalon Drugstore and us knocking on doors, our goal is to have 2,000 people inoculated before the 4th of July. This is a major holiday. Hear my voice. We are not out of this pandemic. We still need you to save your inner circle, save your loved one lives. I plead with you in my closing. Please get the vaccine. They will give you numbers at the end of this session, who you can call at this time. And I do thank you for hearing my voice.
Carla has been so busy delivering vaccines and administering them. I really wanted to have her here to tell her story a few weeks ago, but we were finally able to get her to slow down long enough and come tell her story, because I think it's important that the people of Louisiana hear firsthand from people who are out there on the front lines doing the grassroots work that she mentioned, going door to door, but also individuals who have that personal story about COVID and how devastating it can be to families, especially for families who lose loved ones to that disease. So, Carla, I thank you so much. I am inspired more than ever by people like you. It's the healthcare workers who have been the biggest heroes throughout this pandemic. And so I want to thank you, because I can guarantee you that given the number of people that you have vaccinated, you have saved lives and you have improved lives. And so thank you so much, and thank you for being willing to tell your story. And I'm absolutely confident that Carla would love to give everyone their shots in Louisiana. That's not going to be possible, but she wants to get to 2,000 by July the 4th. The good news for everybody else is there's plenty of vaccine. There's more than 1,500 locations where you can receive your vaccination. And LDH is going to be doing more work to stand up efforts like the one that Carla is engaged in, so that we make it even more convenient for people in their homes, at their place of employment, and at the time that they express a willingness to be vaccinated, to actually receive that vaccine. We're also going to be offering some perks that come with your vaccine, in addition to the peace of mind and the good health that you can expect from the vaccination. The first is Shot for a Shot, which is a partnership between the Louisiana Office of Alcohol and Tobacco Control and the Louisiana Restaurant Association. So using your vaccine card or your LA Wallet digital copy proof of vaccination, this month in June you can receive a free drink, non-alcoholic or alcoholic, at certain participating restaurants and bars within 7 days of receiving your shot. So please kick off the summer with a refreshing beverage while also supporting our local restaurants and bars, but you'll do that by getting vaccinated. And by the way, you may have seen it where Budweiser announced that it's going to give away beer to individuals once the country reaches President Biden's goal of having at least 70% of Americans at least partially vaccinated. So appreciate the folks at Anheuser-Busch for doing that. We're already giving you a free drink here this month in Louisiana, as I just mentioned, so let's be good neighbors. Get your shot, and then if you're so inclined, then you can get your drink and get a beer later. And as always, enjoy responsibly. The next perk that I'm excited to announce today is free entry into all of Louisiana's 21 state parks and 18 historic sites through July 31st. This offer is made available to everyone who has been vaccinated, and it matters not when you received your shots. So I want to thank Lieutenant Governor Billy Nungesser and his team for working with us to make this possible. And there are new and improved facilities across the state of Louisiana, and there's never been a better time to get out and take advantage of Louisiana's beautiful state parks. So whether you like to hike or bike, paddle, tube, swim, just enjoy the peace and quiet of nature, there really is something for everyone at our state parks. Many of these parks also offer splash pads for kids. So please visit lastateparks.com for a full list of sites. These parks are part of our Bring Back Louisiana Summer initiative, and stay tuned for more incentives and rewards that will be offered in the near future. But please don't wait for the next incentive to be offered to get your shot. You're going to get the numbers here in just a moment, and it reinforces what Carla said a moment ago, and that is that we are still in a pandemic. We have people contracting the virus every day, getting sick every day, going to the hospital every day, and unfortunately dying every day. Thank goodness it's in smaller numbers than we were reporting just a number of weeks ago, but it's still significant. And so please don't wait to get your vaccination. Do that just as soon as you possibly can. There are a number of national reward programs that you can take advantage of with proof of vaccination. So I would encourage you to visit vaccines.gov/incentives to see a list of those. And if you go to vaccines.gov, you can put in your zip code and actually find out which of those 1,500 locations you're closest to. And you can take advantage of those locations and the phone numbers and contact information that you'll get to actually make an appointment. So let's step up and be vaccinated so that we can all be protected and enjoy the summer. You're going to hear some information from Dr. Marcel in just a moment on the status of our vaccination program. And while we continue to be encouraged, more people are being vaccinated every day. Quite frankly, the uptake is not what we would like it to be, and so we would certainly want to do better. She'll give you the news, but we're at basically 32% of all eligible Louisianans are now fully vaccinated. 72% of those 65 and older are fully vaccinated. And there's a lot of shots that have been given out, more than 3 million. But quite frankly, we still have a lot of work to do. If you have questions, you want to talk to a medical professional, and you need help to schedule an appointment, if you're homebound and want someone to come to your home, please go to the vaccine hotline. Call 1-855-453-0774. You can also, again, find that list of providers at vaccine.gov. And just a reminder to you, the vaccine for COVID is free. Today we're reporting 300 new cases of COVID on 13,161 new tests. So about 2.3% of the tests reporting today yielded a positive result. Unfortunately, we're reporting 10 new deaths over the last 24 hours, and that brings us to 10,605 deaths since the start of the pandemic here in Louisiana. 296 patients are hospitalized across our state, 24 of whom are on mechanical ventilators. So I'm going to ask Dr. Marcel to come up now and share some additional information with you. As we always do, if you've got questions for Dr. Marcel, please ask them, and then when she leaves the podium, I'll come back up, wrap up with a few additional remarks, and then take your questions. So, Dr. Marcel.
Good afternoon, and thank you for having me here. And thank you, Nurse Carla Brown, and thank you for sharing your story with us, and thank you for all of the work that you do and have continued to do here in Region 2, which benefits us as well as the state. And I'd like to note, in addition to honoring her husband, Mr. David Brown, that there are 10,604 flags in front of this Capitol to honor each life of every Louisianan who has passed as a result of COVID. You have heard the numbers the Governor Edwards mentioned for our current hospitalizations and new cases. And as we look at new cases, we continue to monitor, and we are pleased to say that currently for the last 2 reporting periods, our percent positivity statewide is less than 5% at 3.2. And while the preferred ideal number is 0, less than 5 is pretty encouraging, but we do still have some work to do. Over the last 2 weeks, statewide, hospitalizations per capita have continued to decrease, and our epidemiologic curve, which demonstrates the number of new cases, has continued to show a downward trajectory for the last 3 weeks, the last 22 days. And so those numbers are very encouraging, but we still have to stay vigilant because, as previously stated both by Governor Edwards and Nurse Carla Brown, we are still in a pandemic. Of the tests that are being conducted in the state of Louisiana right now, we find that the largest number of cases, the largest group, is in our 18 to 29-year-olds. And so we do continue to ask all people to stay vigilant and consider vaccination. As we look at the number of new cases, we do analyze specimen for the presence of variants. Here in Louisiana, we do have an established presence of the UK variant B117. Our percentage of that is 78% compared to 73% nationwide. We do believe that the vaccine gives coverage. This is a very transmissible variant, but we do believe that protection is provided, and it's another reason to consider vaccination. We also have a small percentage, 3% of the P1 or Brazilian variant here as well. There are B1B617 cases that are here, the Indian variant, but they are too few to register a significant percentage, but we do want to make note so that people will continue to remain vigilant. On a different note, I'm pleased to say that we are over the 3 million mark in doses administered. The state has administered 3,027,920 vaccine doses. We are really pleased with that. That represents about 36% of the population having received an initial or single dose, and 32% of the population being fully vaccinated, and that's by all 3 vaccines available, the Johnson & Johnson, Pfizer, and Moderna. And while we are pleased that nearly a third of our population is fully protected, we are not comforted or comfortable or complacent at this time, because that still means that 70% are not. And so we do have a ways to go, but we want to acknowledge the progress that has been made thus far. As we monitor vaccine administration, we do look at more than the numbers of vaccines given. We certainly care that people are vaccinated, both for their individual coverage and protection, as well as for our collective community immunity. We also monitor to be sure that people safely tolerate the vaccine and that they do well. And so we do track breakthrough cases. Those are monitored nationally, and we do track what happens here in Louisiana. Nationally, of people who have been fully vaccinated against COVID, 2,298 hospitalizations were reported, about 1,700 of which were attributed to COVID, meaning some people who were fully vaccinated were admitted, but not all admissions post-vaccination are COVID-related. Deaths currently are at 368. And here in the state of Louisiana, our count is at 23. And while every life counts and one is too many, percentage-wise, looking at the rate, that is far less than 0.05. That is a percentage that represents 0.002% of all people who have been fully vaccinated here in the state of Louisiana. In closing, I would like to continue to encourage people to consider to get vaccinated. Those of you who are not, please look at the data. In the same way that misinformation goes viral, let's let the facts go viral. If you have questions, ask ask reliable sources. Go to ldh.la.gov, cdc.gov. If you have a primary care physician or provider, by all means, please ask your physician, even if it's a specialist. It doesn't have to be a primary care physician, but if you have a trusted physician, nurse practitioner, physician's assistant, someone in the healthcare community who can answer your questions, by all means do ask. The more information, we believe that the better decision you will be able to make for yourselves and for Louisiana. I would like to mention lastly that there is a COVID vaccine hotline. That number is 855-453-0774. Again, that number is 855-453-0774. And if you have any questions, if you don't know anyone to ask or you're not sure or you want to check the information, call that number if you have any COVID vaccine-related questions. You can find out where some of these 1,500 sites are that vaccines are being administered. And if need be, they can help you schedule an appointment. That can be a long number. You can call 211 and they can connect you to our COVID vaccine hotline. But there is access. Access should not be a limitation, and even if that's a problem, make that known as well. And we will make every effort we can to get every person vaccinated. And again, if you have questions, ask. And in closing, for real this time, I would like to add or reiterate what Nurse Carla Brown said. These vaccines were made to save. They were made to save. We follow mitigation measures. They have helped us. But this is our power tool in the toolbox, and they were made to save. And let's not forget the 3 Ps, the benefits of vaccination right now until the end of July: protection, peace of mind, and now perks. Thank you. Yes.
Doctor, the 23 deaths you mentioned in Louisiana, those are deaths after the vaccination, but they're not connected to the vaccination. Could you explain that a bit?
You just did. They are deaths. There are 23 deaths, 0.002% of the total number vaccinated, and they are people who did not die in that immediate window in a direct adverse vaccine reaction. Like they didn't get immediately anaphylactic and die as a result of the reaction to the vaccine.
Anything else?
Well, thank you.
Thank you. Thank you, Dr. Marcel. Appreciate your work and all the work that's taken place by people at the Department of Health and all of our partners across the state. Just a few more items to update you on. The first is flood recovery. Yesterday, President Biden approved my request for a major disaster declaration for the severe weather, the rain, the flooding that occurred in mid-May. And I certainly want to thank him for his swift response to that request. The parishes that are now eligible to receive federal aid under that declaration are Ascension, Calcasieu, East Baton Rouge, Iberville, and Lafayette. For those people in other parishes, if you have received damage, then it's important that we know about that because we do have the ability to at least request that additional parishes be added to the list that already is in the declaration. And so we can amend this over time. So residents and business owners who sustain losses in the designated parishes can begin applying for assistance by registering online at www.disasterassistance.gov. They can also call 1-800-621-FEMA. That's 1-800-621-3362. And for the hearing and speech impaired, the number is 1-800-462-7585. These toll-free telephone numbers will operate from 7 a.m. to 9 p.m. 7 days a week until further notice. If you are in a parish that was not listed and you sustained damage, please visit damage.la.gov to self-report. There is still time to do that, and those reports of damage will be taken into consideration as to whether additional parishes are included in the declaration. Speaking of severe weather, hurricane season started earlier this week on the 1st of June. And I know that hurricanes are the last thing anybody wants to think about right now, but you got to think about it before it's too late, because you got to be prepared. You have to have a game plan. So while you're making your summer plans, make sure that you have your hurricane plan ready too. The first part of that is to get your COVID vaccine. If you have to evacuate, if you have to shelter, really having that COVID vaccine is critically important for an additional reason other than those that we've already talked about. Please visit getagameplan.org for a list of supplies and to make sure that you're stocked up. And you can also register for disaster SNAP benefits. You pre-register, I should say, for DSNAP as part of your emergency plans. You do this through the Department of Children and Family Services. It simply allows you to get a head start on the application process that determines final eligibility if DSNAP should be authorized in your parish. You can also pre-register for DSNAP at getagameplan.org. And we always ask you to monitor your weather closely, follow the guidance given by your local officials as well. Obviously, we can't control the weather. We don't know if and when a hurricane will make landfall here in Louisiana, but what we can control is the degree to which we prepare and when we do that. And now is the time to prepare. A couple of updates on the legislative session. We're obviously in the home stretch now. The session will end no later than 6 p.m. 1 week from today, next Thursday. The legislature has passed the budget, and it is still being reviewed here in the governor's office and principally at the Division of Administration. The good news is it does contain a significant teacher pay raise of $800 per year and a $400 support worker pay raise. And I'm very thankful that the pay raise was given and that the latest REC forecast for revenue for next year improved to the point where that could be given, the raise could be given in that amount. And of course we still have more work to do. I'm mindful of that. We're all mindful of that, getting to the southern regional average in teacher pay, and so you can safely anticipate that I'll be making additional requests for teacher pay raises next year and the year after that. I am hopeful that we can find some dedications, make sure that some of the bills that are still out there will contain statutory dedications for the benefit of early childhood education in Louisiana. Unfortunately, the legislature did not include my request for $6 million general fund for early childhood education, but there should still be some additional funding available for that effort through these dedications. As you know, early childhood education is extremely important to get kids off to a great start and so that they start school ready to learn. So at this time, I'm going to take a few questions if you have any. Yes, sir.
What do you make of the proposal to extend the 0.45 sales tax rate beyond what it was originally proposed?
Yeah, well, first of all, we can all acknowledge the need for additional funding for transportation. It's critically important. I think we've waited for the Easter Bunny to bring roads and bridges long enough. That's not going to happen. But the devil, as always, is in the details, and if the bill gets to me, I'll certainly take a look at it. I would want to be in a position to support it. For example, I want to make sure that we're not diverting funds away from the general fund before 2025, which is when the 0.45 is set to expire. And then we have to look at other elements of the bill as well, and to make sure that it does contain, if it contains a list of projects, that they can be financed with the revenue that's going to be generated by that mechanism. but also any other language that's in the bill. But I am generally supportive of that concept. You see many states now moving away from just user fees and gas taxes in order to fund infrastructure improvements, and they are using general fund. So I think it's something that we ought to consider here in Louisiana. And so, again, the devil's always in the details, and I know that really just got started in earnest this week. And so it's evolving rapidly, and I haven't been able to get an update today, for example, about where those negotiations are. Yes, sir.
Governor, earlier today, BRAC issued a statement calling on state leaders to end the federal unemployment enhancement payments before that expiration in September. Can I get your take on that?
Okay. I'm not sure that I understood. So BRAC or BRAC?
BRAC.
The Baton Rouge Area Chamber?
Yes, sir.
And this is UI benefits?
Yes, sir.
Okay. So my answer hasn't changed since the last time I was asked. I received a letter, I think about 10 days ago. I'm not exactly sure about the date there, from a number of business organizations asking us to take a look at ending the enhanced federal unemployment weekly benefit of $300 a week before the scheduled termination of that on September the 6th. And so we have retained the services of an economist, Jim Richardson, who is preparing a study to determine for the state of Louisiana, given our particular situation here, is that a wise thing to do or not? Are there more cons than there are benefits and so forth? I don't have the benefit of that study yet. What I can tell you is we have a state in Louisiana that's heavily dependent upon tourism. We know that tourism isn't back in full swing, and so we know that for a large number of these individuals, there are not jobs yet for them, and I don't want to prematurely cut off these enhanced benefits for people who don't have jobs. The other thing I will tell you, there's a really positive stimulative effect in our economy because of these payments. To date, for example, over the course of the pandemic, more than $8.2 billion in unemployment insurance benefits have been paid out in Louisiana. It's one of the reasons why the economy is performing as well as it is currently, and why the REC was able to recognize so much additional revenue at the most recent REC meeting. So we're not going to do it prematurely. We're going to figure this out. Whether it lasts through September the 6th, I'm not yet sure. But it shouldn't be lost on anyone that Congress chose September the 6th because by that date, it's post-Labor Day, and school is resumed all over the country. And they know that child care is a particular problem right now. And so the design of the benefits was to at least get through the summer months for those people who were unable to get a job. And now we actually start school a little earlier here in Louisiana, which may mean that we can afford to do this in August. I would like to remind everyone, too, that while at the outset of the pandemic, we waived the work search requirements in order to qualify for unemployment insurance, many months ago we reinstated that. So any individual who is currently drawing unemployment has to meet those work search requirements and show that they are trying but unable to get a job. So I don't want anyone to be unmindful of that as well. But I don't have an announcement for you today. I need the benefit of the study that we've commissioned, and hopefully within the next couple of weeks we'll be able to make a decision. Yes?
Hi, Governor. What would you say to a Louisiana resident who's facing a job market where their existing skills don't match the skills available? I'm thinking of folks with degrees whose jobs don't exist anymore after the pandemic because our economy has changed and people are retiring earlier than anticipated, and they're being matched with jobs working in fast food or warehouses, but they may hold a degree in hospitality. How do we keep growing the middle class in Louisiana after the coronavirus pandemic has been handled?
Yeah, well, first of all, this was a challenge even before the pandemic because we have, not just in Louisiana, but across the country and across the world, the nature of work is changing. The jobs that are in demand today and in the future are not the same jobs that were in demand before. And so quite often a different skill set and knowledge base is required for success. And so for those individuals, we encourage them to take advantage of all the opportunities that they have for example, through the Louisiana Community Technical College system, to upgrade their skills and to upgrade their knowledge. A big part of the federal funding for higher education in Louisiana will go specifically to that purpose, both at our four-year universities, but principally at our two-year institutions as well. But I think you make a great point. Even if you have an improving economy and jobs become available, those jobs are not available to everyone who is unemployed. And it's another reason why we're not going to prematurely discontinue the enhanced benefit, but we are going to work very hard through the Louisiana Workforce Commission, all of our higher education institutions and so forth, to try to connect people to jobs to the extent that they are qualified and available today, but also to get them in a better position going forward, so that it's something that they can enjoy, not just in the short term, but going forward, to have a new job. And that's what we've been working on in Louisiana for a long time. It's been made more important by the pandemic, however. Yes?
One more question. Has your position changed any after a bill that will allow residents to carry concealed firearms without a permit?
No. Look, I've had this position for many years. And I think somewhere north of 70% of the people of Louisiana agree with my position on this. The current system we have for concealed carry in Louisiana with a permit that requires individuals to have background checks to make sure that they are educated and that they are trained, that they have some marksmanship training and so forth, and that they know they're under an obligation to inform a law enforcement officer when they have an interaction that they are in fact carrying a concealed weapon. All of those things are very, very important, and I think they strike the right balance. A law enforcement officer doesn't want to discover that someone with whom they're engaging has a firearm for the first time while they are actually searching them, and that leads to a lot of problems. So my position on this has not changed. Yes, sir.
I was wondering, when you first learned the claim that Ronald Green died from a car crash was disputed, and when you saw the body cam footage.
I don't remember dates. And the first part of your question is a little bit hard to answer too, because the issue is really not, it's whether a communication was made either to representatives of the family or to the family that he died in the crash or from the crash. And really, I think that remains at the heart of the matter as to actually what caused his death. I know that, without knowing the date, I know that prior to inviting the mother and sister of Mr. Ronald Green and their attorneys and several members of the Black Caucus to GOSEP in October of last year to show them the videos, I did look at them. I don't remember exactly when that was, but it was before they came in to see that those videos.
Was it before or after 2019? I mean, 2019 or after 2019?
Well, it was last. I'm not following your question. It was October of 2020. Yeah, it was October of 2020 whenever the family came in, and it was some point prior to that I viewed the videos. Yes.
Elsewhere to restrict accessibility to voting. We haven't seen that similar movement here in Louisiana. I'm wondering if this was a discussion you had prior to the legislative session with lawmakers, or if this just, sort of what you think about that movement and why it hasn't come here.
Well, there have not been the same kind of efforts here that we've seen across the country to restrict voting. I think potentially for a couple of reasons. One of which, I don't know of any incidents in recent memory where there's been any fraud on a scale that would warrant changing the way that we vote or that we register to vote, and certainly not making it more restrictive. Secondly, I believe that the legislators in Louisiana understand without asking that I'm not going to sign a bill that makes it harder to register to vote or to vote in Louisiana, in light of the fact that our elections have been held in a way that I think have not resulted in any real allegations of fraud or problems. And we're not going to create problems, for people unnecessarily, especially something that is so important as participating in our democracy and choosing who our leaders are in the direction of our state, the direction of our country. And so we're just not going to do that in Louisiana while I'm governor. And I'm gratified that we don't have a lot of bills that have been filed that have that as their principal goal. But there are some bills that, should they hit my desk, they will not be signed because they do make changes that are unnecessary. And quite frankly, changes that I believe that invite problems that we don't currently have. Yes, sir.
Governor, here we are more than a year later. We have over 3 million COVID-19 vaccines that have been distributed. Looking back where we were with hospitalizations, people on ventilators, what does it mean to you personally as the governor of this great state to see the progress that we have made?
Well, look, I am so gratified that we are where we are, knowing that we're still in a pandemic and knowing that we still have a lot of work to do. But to be able to be here in a room, you're not wearing a mask and I'm not wearing a mask, for the first time in, I think, 15 months. I had a reception at the governor's mansion last night with legislators, and it's another example of how we can get back to normal. The ability to just interact with my mother and being inside, to have a meal, to exchange a kiss, those sorts of things, incredibly important. And because it wasn't that long ago, we're just in early June. In early January, we had the most people hospitalized ever, and the strain on our system was almost unbearable. And again, we were in January of this year. This started in March of last year. And quite frankly, I was worried that we might be at the breaking point in terms of our healthcare delivery system. I mean, the stamina of our healthcare professionals and so forth. So to see us doing so much better now, and to know that it is because of the vaccines, I am very thankful for science and for the researchers and the doctors and the people who made the vaccines possible and have them in such large numbers. But we should all remember that the vaccine by itself is insufficient. It takes vaccinations. So you got to marry up vaccine with arms in order to really fully get back to normal. But the short answer to the question is, I get a lot better, more sleep and better sleep today than I have at any point since the pandemic started. Look, I want to thank you all for continuing to cover the events of the day in Louisiana and to get accurate information out to people all across our state. And I want to finish up by asking us everyone to continue to do what you can to be safe. If you're not vaccinated, you should be masked when you're inside and around other people. And you can be vaccinated and then become an ambassador for the vaccination program. And I understand that at this point it's unlikely that what I say to people who've chosen thus far not to be vaccinated, it's unlikely it's going to make a big difference. So I'm asking those people, reach out to your doctor, reach out to your pastor, have those conversations, have them with your family, and get good, reliable information. And we can make that available to you if you don't have that doctor-patient relationship. So let's do this together. Let's get back to normal. And as always, let's be a good neighbor to one another. I look forward to speaking to all of you next week. I think that will be at the conclusion of the session. So sometime shortly after Sine Die, which will likely be about 6 o'clock on next Thursday night, we'll be back here with another press conference and a wrap-up of the session. Until then, everyone, please be careful. Thank you again. I look forward to seeing you next week.